Do another round of our full routine. So we're going to be doing the full 60-minute routine start to finish. This is going to be the 5th round of the routine that we do. So rounds 1 through 4 are on YouTube, ready for you to watch and do again. So we'll just kind of get started. So our first 2 points that we use are the solar plexus and the adrenal. We hold these 2 points to kind of check in. As well as on the dorsal surface, we're also feeling for the dorsal pedal pulse, because we also cover a little bit of pulse assessment, which we talked a lot about last weekend. So we're feeling here because the solar plexus reflex tells us the state of the nervous system. It tells us whether or not they're jittery, whether or not they're holding on to certain nervous system stimuli. You know, it's just also a great relaxation point as well, but it just helps us to both ground the client and kind of take temperature. Then we move into our adrenal reflex. The adrenal reflex, again, slightly sensitive point, but tells us more about the long-term hormone drip that's happening in the body. So if the adrenal reflex is non-existent, if you're just fallen into the space, the adrenals are very fatigued, as well as if you're feeling lots of dryness in that space, or if you're feeling like that hard nodule in the adrenal reflex, that means that the adrenals are overproducing. They're starting to calcify, which is not a fun thing. So we're just palpating those reflexes to see kind of where the body is telling us the hormones are at this moment. Note that these points are held for about 30 seconds, just to kind of start and end our session, because we'll do this at the end as well. As clients continue to come to you, it'll be kind of like your way of reminding the body, okay, you remember this? This is where we're starting. We're going to do it again, that thing where we ask you to heal and come back into balance. Okay, can you grab me 2 hot towels and a dry? Thank you. Cordelia gave me a dry. Perfect. Okay, so we use our hot towels first. Make a nice little warm towel booty, followed by fleece. Insulate that heat, press it in. Works to both relax and open the tissues, but also to clean the feet. Just in case clients are feeling a little bit not feeling. It's never the clients who apologize. It's always the clients that are like, here are my feet. Here they are. The ones who apologize are like, I haven't had a pedicure since yesterday. I'm like, don't worry. Don't worry about it. So another unique aspect to our routine that we're going to do, as opposed to other routines that you might have seen or that you might have practiced, is we're not going to be bouncing back and forth between the feet. We will do the entire routine on the right and then the entire routine on the left. That'll give us an idea of what's happening on the right side of the body versus the left side of the body. It'll also help us, throughout the entire routine, we're gridding and we're structuring and we're making sure that we know where we are, and that right first complete routine and then left complete routine also does that. We're really making sure that we know where we are instead of bouncing from reproductive one side to reproductive the other side and then digestive one side to digestive the other side. Like it gets a lot. Okay, so after we finish pressing in the last bits of heat from that towel, we're going to wrap the left foot with the towel, but then keep the dry towel on because the left foot is going to just chill while we work. Any questions so far? Our demo hasn't died yet, so that's a plus. Okay. So we're going to start with our relaxation techniques. Just getting the foot warmed up. These are probably the most massagey part of our reflexology routine. Don't get caught up in them. They are both relaxing, but they're assessment based. So our job is to get into the tissues and get out of the tissues, feeling for the state of the calf, feeling for whether or not the ankle is moving, feeling for how the metatarsals shift against each other, whether or not there's impingement at all. As we do this kind of vigorous movement, whether or not you're hearing pop, 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 crack, 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 you know, all of those different things. But we're not doing reflexology at this point, so it's not really what we want to focus on. It's just a nice kind of warm up. First reflex that we're going to walk is the spine, and feel free, like, as I shift angles, like if you want to see and move around, you totally can. So we're going to be walking the spinal reflexes first 3 times.
Why the 3 times?
Because 3 is a magic number, and when I've done it 2 times, people have spontaneously combusted. That's the short answer.
9 is divisible by 3.
9 is divisible by 3, so I guess you're safe with 9, if you really wanted to go there. That's a little bit overkill, in my opinion.
Well, for an Eastern philosophy, 9 is of significance.
If you want to do it 2 times, you totally can. If you want to do it once, you totally can. Like, alter the routine based on what you feel. Sometimes if as I'm going, and if I feel an area is really where I need to focus right off the bat, I'll shorten certain areas based on the routine. Like if we normally do it 3 times, I may do it 2 times or only once, just depending. But then likewise, you know, if we only walk an area in the routine 1 time, but you really feel like it needs another pass, give it another pass. You know, as long as you're aware of your time and you're not like totally, you know, giving somebody an hour and a half who came for an hour, like, be respectful. But okay. So now we're on the toes representing the head space, also the neck, nails being our soft tissue reflexes, telling us all about what's happening in the teeth, the jaw, eyes, sinuses. We do the big toe, but then the big toe is so important that it gets its own routine. Ooh, and good thing, because she has some neck tension, let me tell you. Goodness. It's probably from all those Oreos. No judgment, just saying. Okay, so we're clearing the big toe, which represents, again, remember as you're walking that each of these reflexes don't just, ooh, there was a nice little pop in that toe. They don't just represent a physical reflex, they also represent a mental emotional reflex. So as you're clearing the big toe, you're also clearing the thoughts and the mental stress from somebody's experience. You know, you're telling the nerves to not just work on the physical equivalent, but also the internal equivalent of that reflex. So now we're moving into the dorsal reflexes. A lot of lymphatic stuff through here. Shout out to Sally Kay, who's going to be here next weekend. She will be teaching a 2-day reflex lymph drainage class, which we're hosting, which is the biggest class she's ever taught, 34 students. Super proud of that. But we're basically, it's a lot neater to see on a foot that's swollen, but that little pumping just really gets the lymph going in the foot. Shake up the metatarsals a little bit, get everything open and mobile, there's where that neck tension is coming from. So she has a nice bit of restriction in between the second and third heads of her metatarsals. So we're probably going to hold in there. So it's that upper back knot that just won't quit, which is radiating into her head. And that's where a majority of her tension is coming from. Oh, and we found a spot. So when we find a spot, it's very interesting because as you palpate, the body will almost grip you. You press a point and you're walking, and then sinkhole. And it's just the body sucks you in and it magnetizes your touch to that area. And that's what I'm feeling here is as I hit that spot, the body was just like, nope, stop. Stop what you're doing. Hold here. This is where I need you. Yeah. Interestingly enough, it's also over the reproductive reflexes. So kind of in theme with our morning discussion. No, and it's not letting me go. So basically, as we find that point and we hold it, and we're stuck here for a little bit, which is terribly boring to watch, but very interesting to feel. You're waiting for the body to kind of release you, which is starting to do now. It'll start to suck you in deeper, and then it will gradually start to fill itself back up again. And then the reflex will kind of go dark. It'll not feel as lit up as it did before. And that's a sign that you've completed the treatment of that spot. And there's our problem child right there in between the shoulder blades. So on the dorsal aspect represents the back of the body, whereas the plantar aspect represents the front of the body. So right here, we're right below the shoulder line guideline, yeah, but above the diaphragm guideline. So we're right in between the shoulder blades, right in between the metatarsal heads, and in between zone 2 and 3. Again, that digestive component. I was joking about the Oreos, but apparently the body wasn't. So we're looking at how maybe some acid reflux tendencies may be present, some dietary reflex stuff might be present, because there's so much physical tension, that earth quality, that overgrown quality. Maybe she's worked out a little bit too hard and the body has innervated that space with a little bit of scar tissue or tighter fascia. But whatever it is, we're just asking the body to release that extreme level of tension. Like, tension is appropriate. The war on tension that body workers have waged over the years is ridiculous. Like, tension we need the bones to be held in place by the interlocking webs of our body mechanisms. But too much in one place, often counterbalanced by weakness in another, is inappropriate. So we just need to ask the body to check itself before it wrecks itself. Like that, AJ?
That sounds like a rap song. So
It is.
I've heard it before.
Like that one, yeah.
Yeah, Ice Cube sang it a couple times. But true.
Very true. Yeah, and that spot's just not going away. So now we're getting into the deeper traps. And again, like it literally feels as I trace that space in between the metatarsals, it's this ditch, it's this divot that the body just is almost asking me to come into, asking me to press. And so as I meet it halfway, maybe using about a 3 to 4 in pressure, really getting very specific on that point, and I'm getting a stimulus right here indicating that my nervous system is responding to the work. So we're getting communication here. We're getting some electric charges through here. Wouldn't be surprised if she started to feel some referral sensations as well. So I'm going to move on because this has taken just a little bit too long. When a point takes a little bit too long, chances are it's just trying to suck up your attention, and there's another point that will turn it off for you. Giving you a lot of nuanced stuff this morning. Anybody have questions on that? Like, that's a lot.
In the meantime, hello from Buffalo. Hello from the Treasure Coast Pirate Fest.
Oh, Sandy.
Yep. And hello from Lincolnshire in the UK.
Okay. After dorsal aspect of lymph, now we're going to walk the ball of the foot through horizontal zone 2. So starting at the diaphragm guideline, walking in line with each toe 3 times. Again, Why not 2? Because I said so. No, just because it's easier to remember if you at least do it 3 times, because passing it once isn't enough. 2, you're not so sure. By a 3rd pass, you've felt it, like you know what's underneath that space. And I would rather you do a little bit more than a little bit less.
And hello from Chelsea in the UK.
Oh, hey, Chelsea. Just about to, once a couple other details get settled, announce a 2nd round of the UK tour this fall.
Canada, Ireland, Canada.
Yay, Canada. Okay, so now we're going to move into the digestive space. We've already found a little bit of vertical zone 3 influence with that tension. So I'm on guard as we approach the digestive space. So we're walking horizontally in 3 horizontal rows 3 times from the 5th toe to the 3rd toe, stopping just before the plantar tendon, because the plantar tendon doesn't like to be walked across horizontally. It doesn't appreciate that cross fiber-ness. It's also very uppity. It's a very uppity tendon. Its job is to keep the arch intact, and when it starts to become approached by the wrong direction, it really just doesn't appreciate that. So we're going to avoid it, but then we're going to switch our hands and go vertical, which allows us to walk over that tendon, but again, just clearing each zone. If you want to think of the map, the vertical zones and horizontal zones coming together to create a grid, my routine that I'm teaching you is based on that grid. Each section of that grid, we're stopping and we're clearing before we move on to the next one. It just so happens that there are reflexes underneath each of those cubes, each of those blocks on the grid, that tell us information about what's actually happening. Like for this young lady, we're in her liver reflex and there are signs of definite weakness. So diet needs to improve just ever so slightly. No more Oreos.
That does not compute.
Does not compute. Again, no judgment. And now we're going to move into the lower digestive system as I talk about my clients. And but I tell clients all the time, like I had a client who had major heart surgery, and I'm like, look, if you want to have your Coke, if you want to drink your soda, like just be aware that as your symptoms continue to increase, that would be the one area that I would tackle to help mitigate your symptoms. Just substitute Coke with water, But some clients, you try to get them to change a certain aspect of themselves and they freak out. So I always kind of, not preface, but I always counter with, look, live your life, have your fun, eat your cake, drink your wine, whatever makes you happy, as long as it's not hurting somebody else, it's your choice, but at the same time, you've come to me to rebalance, and I'm telling you that this particular stressor is what's knocking you out of balance. So listen to me or don't, but if there's one thing that I would have you focus on, it's that. That is your homework. But if you're having a great week and you want to go partying, or you want to go, overload on carbs, or you want to down a box of Oreos, Lord knows I have. Don't shame yourself for having a good life experience. But at the same time, know that when your symptoms are present, that is not the time to be lax. That is the time to be very aware, very conscious, and to be honest about the things that are tripping you up. Okay, and as we complete our digestive reflexes, we now go back to the toes. Why do we work the toes? Ooh, and she's getting a lovely sweat response. So her toes have gone cold and slightly clammy, which is excellent. It means that her lymphatic system is activating. It means that her urinary system is activating. It means that some emotions and thoughts are coming to the surface as well as her nervous system starts to bring forward that water element, that cold-wet combination. Amazing. Signs like that are what we look for in reflexology to see that the body is doing something. It's processing the work that we're asking it to process. Another client on the table may overheat. Another client on the table may feel stiffness or achiness or heaviness. Another client may totally pass out. It really is very different from client to client, but she's having what we would call a watery response to the session. Yeah. It's lovely. It's what we want. But again, I mean, all we're doing is asking the body to come back into balance. That's it. So as we do that, the body has full reign. We're not telling it to do something specific. Somebody writes on their health history form, I have back pain. We're not spending 20 minutes of the session digging through the low back reflexes. Because what if that back pain is coming from a kidney thing, or reproductive thing, or lower digestive thing? Or what if it's referred from the hip? We don't know. We don't know. So we're just asking the body to come back into balance, whatever that looks like, whatever that means. Okay. We finish our routine with the lower body reflexes. We can even see the shea butter is actually excavating this really nice line right over her kidney reflexes. If you wanted to see that, it's beautiful, absolutely beautiful, which indicates the dehydration aspect. She also came in with coffee this morning, and that's part of the issue is the caffeine, because caffeine would deplete the liver, it would also tighten the muscles, it would leach calcium from the tissues, which would create the hypertension. Like, coffee explains a lot. But at the same time, we're not done with the body yet, so we want to make sure that we're considering all options, but just really, really neat visuals. If you wanted to come around and look, you can see the line right over the kidney. It's a great example of a kidney line. It's very clear. You see? Mm-hmm. Yeah, literally right over the kidney reflex, like somebody took a razor and just slash. Yeah. So that's what we look for. Lines indicate dryness. They indicate fracturing of the tissue. It's not something we want to see over the kidney reflexes, which are a water-based part of the system. Yeah. But I've seen worse than that. I've seen way worse than that. That's an easy fix. That's a quick fix. She's been on a coffee kick for maybe 4 months, I would say. But that's easy. That's repairable. She's not a 56-year-old man with congestive heart failure who's on a coffee binge. It's a very different set of circumstances. Still relevant. Still relevant. So we found another spot. There's a hyperactive spot in the right glute. So we're just holding that glute spot. Also very close to the ovarian reflex. Again, part of that reproductive cycle. When we see markers for weakness and when we see markers for reproductive stuff, one of the discussions that I kind of sticky note in my head to have is the idea that especially younger women in a Western society, they're taught to not eat and they're taught to look pretty. And so when we see markers of deficiency, but also markers for reproduction, it's the combination of needing more literal meat in the diet, needing more, not if you're vegetarian, not meat, but mushrooms, lentils, beans, some fibrous, thick stuff, because if you're shedding a lining, you need to replenish that lining, and that takes energy. And if your body's not ingesting the same level of energy that it's excreting, especially around the menses, that can be a really important part of wellness that's underlooked. How many women have come into my office saying, I have terrible PMS symptoms, and that's a week of their life that's just wasted each month. They can't focus on anything else but the pain and discomfort. What if it was as simple as talking to them about dietary choices? Imagine. Okay. Do our dorsal ankle pump. right over the, again, the reproductive reflexes. These would be the fallopian tube reflexes because we have a female on the table. We would code switch that to the vas deferens reflex if we had a male on the table. Now we're going to trace the cuboid notch. Cuboid notch, very important because it represents the hip, knee, leg reflexes. So the ascending portion of the cuboid notch represents the quads, the descending portion of the cuboid notch represents the hamstrings, and the plantar surface of the cuboid notch represents the calves. So where tension is along that triangle gives us an idea of where the lower body girdle is kind of pulling its puppet strings. Learned that from working on a lot of runners around Gasparilla. Okay. And last part of our technique is going to be the heel. So we're going to horizontally walk all the way across. 2 rows, and then go vertical in all 5, 3 times. And that's it. Then we do the exact same thing on the other foot. Nothing changes. The only thing that would possibly change as you get more comfortable in the routine is where you choose to stop and hold points. And again, all of this is on video. So if you want to go back and learn it and relearn it, and there are separate videos where I divide each of the techniques into separate things, like this is literally the routine that I do on each and every client who comes in for an hour session with me, without fail. This is the routine. I don't deviate from this routine except for the point work. But so as long as you understand where you're going, that's pretty much it. Pretty much it. Somebody just ask a question or something on the comments?
No. More people from Ireland decided to represent. One lady said she's putting off her shower to watch this.
Ah, that's fun. Who had the question? Did you have a question?
I was gonna ask a question. So if someone comes in with like a specific area during this, say, the 60-minute routine,
Mm-hmm.
like in the case that we're focusing on reproduction,
Right.
how do you build that into the routine for each foot?
Yeah, so we're touching the reproductive system as we're doing the ankle stuff.
Okay.
Yeah. So if you know your reflexes, you can stay there. But again, the goal with reflexology isn't to be press button fix issue. So we have a client who is coming in expecting, which is a very key word, expecting for us to help them with a particular issue. We as reflexologists know that if the body is not ready to fix that issue, it's not going to fix that issue, you know. But what we can do is we can ask the body to relax, we can ask the body to release tension, and we can feel the state of the other reflexes, which will tell us why that system is compromised.
Okay.
So it's not necessarily about when you get to the reproductive reflexes, press harder or press longer. Instead, it's about as you walk through each of the areas, you know, is there reproductive distress due to diet? Is there reproductive distress due to mental stress? Is there reproductive stress due to nerve impingement in the low back? You know, so many factors can be considered, but we can't rule them out until we're actually in the reflexes.
Okay. So then it really goes back to balance.
Yeah.
That's what we do, is balance.
Yes, correct.
So 2 questions. One is just about doing training in the UK and Ireland. Just a question about when you'll be there next. And then the other one actually is how would you assist the client's lungs with asthma during this routine?
Perfect. So UK question. So I'm doing the North Ireland Reflexology Conference the 3rd weekend of September. So I'll be in Ireland for that. I'll probably do a couple class dates before and after. And then I'll be doing the UK in October, probably. In terms of lungs, the lungs are... That's the male. The lungs are tricky business because we walk them so thoroughly. But again, it goes back to One of the reasons why I did the Anatomy Masterclass series is because the lungs aren't the only thing that's involved in asthma. It's just not. So when a client comes in with lung issues, we need to determine what type of asthma they have. When we talk about the energetic tissue states, does somebody truly have an inflammatory asthma? Yeah? Or do they have a watery mucus-based asthma? Do they have a constriction-based asthma? Yeah? Constriction can take place without inflammation. So as we assess the various reflexes, we're asking the body what type of issue they really have. So as we get into the lungs, we can help the body relax by doing the whole session, but it's not as simple as treating the lungs by pressing the lung reflexes. We have to work the entire body to see where the homeostatic mechanisms are falling apart. Does that make sense?
Let's see, questions about, somebody wanted to emphasize your trip to Toronto, and somebody asked if you're ever going to LA, and then somebody's talking about meeting you in Perth.
Fabulous.
Anything else about asthma stuff?
Yeah. So I will be going to Toronto May 17th, 18th for Canada, doing a 2-day class there, right by the airport. Which is up on the website. Then no plans for LA yet, but if you have a school, let me know and I'll come teach. And then Perth will be June 1st and 2nd. Be flying from Seattle to Perth. That'd be super fun. You guys have been awfully quiet. It's kind of scary. Not gonna lie. Is the demo helpful?
Very.
Okay. Do we understand a little bit of the underlying factors of reflexology by hearing me kind of talk it out and talk through it?
Yes,
Okay.
that's what really helps a lot, is actual application of the principles.
Good. And then we've got a spot in the second toe, so we're going to hold that.
Mm-hmm.
This felt like a puffy spot, so instead of an indent, it felt like an excess that kind of needed to be, not to be gross, but like popped and drained. She doesn't actually have something that needs to be popped and drained, but just that's the tissue state. It felt waterlogged, slightly inflamed. Interestingly, inflammation and swelling go hand in hand. Fire and water. The body will cause fever to evaporate lymphatic fluid. So you'll see people who have chronic lymphatic issues also have chronic inflammation because the body is trying to heat the base temperature of the body in order to move the lymphatic fluid and evaporate the water. Energetic tissue states. So fun. Ooh, we got some sensitivity in there. So we'll just hold. Ooh, and my entire forearm has decided to cramp. That's fun. Ooh. My eyes are starting to water a little bit. My body is telling me that something important is happening. So I listen. And I stay. And I allow. Yes. Yes. There we go. Totally okay. Totally okay. Good. Good, good, good. Just keep the breath going. Excellent. So good. So good. Good, good, good. Good. Fabulous. Excellent. Excellent. Let it come down nice and slow. Beautiful. Beautiful. Oh, my hands got so clammy. Excellent. Good, 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 good. Okay, okay. Good. Just keep the breath rolling. Fabulous. Excellent. Okay, so now that the fluid is out, now we have a little bit of anger behind that. So let's just keep the breath going to mitigate that. Let it out. Good. Good, good, good. Good, good, good.
Can I shake?
Of course. Flawless. Absolutely flawless. We have to remember that energy is energy, right? It gets stuck in the body in the forms of physical tension. Emotion is just a thought wrapped in energy. So as we start to ask the nervous system to decompress, we have to be ready to handle any level of experience. I had one client come in to see me who was expecting me to fix their low back, and it ended up being a very unexpected surge of feeling. Afterwards, he felt amazing, but I warned him. I said, we opened up a Pandora box. Yeah, we did not invite it, but it's what came to the party. That's what showed up. We asked the body what it wanted, and it said, I want to rock out with the emotions for 2 seconds. And so we allowed that experience to happen. But afterwards, I warned him and I said, look, be aware of your feelings over the next couple weeks. Continue the process of asking your body to cough up whatever it is still lingering. Talk to friends. Like, even though you may not feel like you need it, force yourself to make those phone calls, those text messages, to hang out with people that you can continue to vent with and can give you some of that therapeutic perspective. If you feel like you need to see a professional, go do that right now. Like, again, even if you feel you don't need it, but because the body has brought this experience forward, it was ready to be let go of at that time. We didn't force it to occur. We asked it, and that's what answered. So understanding that part of the process as we experience a nervous system modality, that's part of the main course, really. And back to what Lena shared this morning, so much can happen on the table, and a lot of it can be unexpected, but situations like this are also very rare. It just is kind of where we're heading in this class. Does that make sense to everybody? Yeah. Any thoughts or experiences that you wanted to share or kind of bring greater clarity to? Points also don't need to be static. They can be rocked. They can be jostled. They can be spun. Not violently, but spun. No, I can't leave. As the body asks you to apply certain forms of pressure, depth is one of your options, but it is not the go-to. Sometimes a point needs you to lighten. Even if you're already 3 to 4 out of 10 in pressure, I found some very dramatic results when the body asks me to back off, and then you hit that layer of fascia, and it is on some nerve innervation that you didn't expect, and the body just releases. Like, wow. I wouldn't have done that if I was so deep, you know? So just, it's about having a conversation with the body. It's about learning how to dialogue, yeah? Unfortunately for the client on the table, they're no longer a part of this process. It's really between you and the body at this point. Their egos came in wanting a certain experience, and the minute that they hit the table and you started asking the body to do its work, they kind of surrendered to what the body wanted, and they gave permission. So a client says, "Ooh, that's sensitive. What's that reflex?" Or, "Ooh, what's that?" Or, "Ooh, what's that?" That's not my job. My job is to talk with the body. My job is to communicate and have a conversation with the intelligent network of ley lines that is before me, whatever you'd like to call those innervations. But just had crazy burp. When we and all of that is relevant. Like, at this point, my body is reacting to her body in such a way that we're having so much of a united experience that at this point, like, my arm spasmed as her body was trying to move something through the nervous system. Like, that's what happens. Some therapists would get freaked out by that, but in reflexology, as you practice, it's actually cool to see that. It's not something that needs to be feared at all. But the client's consciousness, the client's awareness is technically no longer a part of the session, and really neither is yours at this point. Like, you're observing and you're telling your body what to do, but the routine and your body itself is kind of communicating with their body, and they're really dancing in the corner while we're just kind of hanging out in the room, which takes so much pressure off of the therapist. Like, oh, thank God, really don't have to do anything, because we're practicing such an intelligent modality that it's taking the nerve impulses where they need to be. We don't necessarily need to guide them anywhere. We just need to do what the body tells us and perform the routine as Sam told me. And that's pretty much about it. Because this is the series of movements that I've realized has worked the best over my 10 years of practice. Okay, so now we're back to the digestive reflexes. I know. Stomach's a gurgling.
Bluetooth.
That's another thing. Like, watching reflexology is crazy relaxing because your mirror neurons start to kick in and you start to feel that, like, endorphin rush, and it's so difficult, but also so rewarding to see somebody practice because you feel like you're getting work done in the same way because your brain actually literally makes it so. So that's fun. I had somebody reach out to Twitter and scold me. They were like, "Sam, you need to do another full reflexology session video. I need to sleep." Like, oh, that's fun. That's fun. Where are we at? Okay, so we have another kidney point. And we hold. And we think about our grocery list. And we just allow. And I'm being pulled a little bit north. So I'm inchworming a little bit north, a little bit northwest. And we wait. Nope, and we're moving again. And there we go. And that's how you do it. You walk, 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 you trip over something, and you're like, oh, look, a stick. Like, would you like to be thrown stick? Do you want to go back to your tree stick? For those of you that are wondering, the yellow stuff is organic shea butter. That's what shea butter looks like in its natural state before it's been bleached. It's what we use for our sessions because it's very mineral rich. But it also melts with body temperature, so it becomes an excellent medium for reflexology that doesn't give us too much slip and slide of an oil, and also is very nourishing to dry skin. Three, 1, 2, and then when I get bored I start counting in my head because it's very meditative. Just 1, 2, 3, 1, 2, 3. It's like a dance. 1, 2, 3, 1, 2, 3. Or you could practice your mantras and just go press, 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 press. Oh, Cordelia, you could do that. With each press, you could say love, and let that be a mantra practice. So each time you press a reflex, you could say love, 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 love. It'd be fun.
Why just me? Why not everybody?
Oh.
There you go.
Well, because you would actually be doing it. They might think that's a little crazy.
I would actually.
I know you would. It'd be so good. Why not? But that's like the first couple times you do the routine, you're so focused on getting it right, on remembering, and that kind of pulls you out of the space of receptivity. So it's striking a balance. Like you need to practice it enough times to where you memorize it, but also recognize that even if you don't get it exactly right, like the body knows what you're doing. It knows what you're trying to accomplish. We got to hold at the, we have to hold at the middle phalange of the 4th digit. Or phalanx, if you want it to be technically anatomically appropriate. Why the 4th phalange? Why the 4th phalanx of the 5th, or the 3rd middle phalanx of the something? Not sure. Not sure. Body just said so. Body just said so, and I am in no place to question. Getting a little bit of a shake on. And the point begins to melt. Perfect. And we move on. That's how you do it. It's very simple. I don't know why all the reflexology books that I've read over the years have made it sound so complicated and mysterious. Some of them start at the basics and they're like, if you press this button, it will work. I'm like, why? Why would the body ever listen to me? Like, why would I have all the power to, like, then I'd go around killing people and be like, bam, pituitary. Dead. But it doesn't work that way because the body is far more intelligent than we give it credit for. So had to throw that theory out of the water. But then as I started to actually listen to what the body and the modality was actually trying to accomplish, I mean, it all comes back to just the idea of you being a receptive, intelligent body worker who is working with the body, not on the body, you know, having a palpation-based dialogue, and you listening to what the body wants you to do. I've had so many people come in to see me who have said, I've gotten body work from all over the world, but you're the first person that has actually listened to my body. And I felt it. Like, I felt you listening. Like, how unfortunate. How unfortunate that body work is a craft that a majority of practitioners are taught to break down the walls and to not question why the walls were put up in the first place. To barrel through different muscle innervations, to force the body into certain states of relaxation or tension. You know, what if the body isn't ready? That's the problem that I have with, you know, modalities that don't necessarily take a holistic approach, because, you know, sure, you go to the chiropractor, you pop some bones into place. I've seen miraculous things happen with chiropractic care. But what about the client that's told that they need to see that chiropractor 3 times a week for the rest of their life because their bones keep popping in and out of place? So they have hypermobility. They'd be better in a gym than they would in a chiropractor's office, you know, to tonify. But modalities that are limited on their one approach tend to neglect that. So as reflexologists, we get the fun chance to say, maybe it's mental emotional. Maybe it's physical. What system? Can I refer you to a dietitian? Can I refer you to a personal trainer? Can I refer you to a hypnotherapist? Can I refer you to, you know, a licensed mental health counselor? Do you need to consult an endocrinologist? You know, it's so funny where body work is headed. Every time I attend a workshop or hear another practitioner say that my method is the best method and you only need to do my method, I'm like, pfft. Right. It's very, very much the conversation with keto and veganism right now. So keto is one extreme and veganism is the other extreme. Is it appropriate for some people to be on a keto diet? Absolutely. Is it appropriate for some people to be vegan? Absolutely. Do most people need to be keto? No. Do most people need to be vegan? No. Most people are somewhere in between. Ooh, that's some messy stuff. So we've got some very strong hip restriction on the left side. Very strong. Talking about like 8 out of 10 strong. So we're gonna use a little bit of twisting with the foot. Like I'm holding the reflex, but I'm also gently manipulating the direction of the foot to expose the nerve that I'm trying to make peace with. I'm negotiating. This is a hostage situation, and we are negotiating for the health of the hip at this very moment. It's very dramatic. If we divide the actual hip reflex into posterior, inferior, and anterior sections, the posterior would be the fibers that represent the glute max, the inferior fibers would be the glute medius, and the anterior fibers would be the glute minimus. Right now I'm on that band just in between medius and minimus, just before that hip rotates forward. It's just a nice lateral to front lock. And that's how specific we can get once we understand the reflexes themselves. Next month we'll be getting into all the skeletal stuff, because that's the theme of our weekend for March, is skeletal. So we talk about all the joints, all the ligaments. Ligamentous. And the breathing got deeper, and so we succeed. Lovely, just lovely. Moving up. Cuboid Notch, and then heel, and then we're done. And then you can take a break and go pee, and then advanced students will actually get to work on the newbies. Let's see, we have 2, 4, 6, 8, perfect even number.
I have to say that this is absolutely, totally different than anything I've learned or practiced.
Oh,
In many ways. I mean, there's certain similarities, but as far as how you're applying it is totally foreign to me.
Oh, okay.
And you know, so and my way is also effective. And I love when you said that, and when you see people who say, and that's one of the reasons, like somebody asked me, well, why are you going to a reflexology seminar when you know it? And I go, no, there's always a different perspective, there's always something new to learn.
Always.
And this is, you know, kind of blowing my mind in a sense.
Oh, cool.
Yeah, I just wanted to share that because it's foreign. It's absolutely foreign.
Yeah, this is so far from how I was taught.
Yeah.
And
so you developed this yourself,
right?
Okay, because I was going to ask you if you trained outside of the United States, because they do have different perspectives.
They do, which is why we're bringing them over.
Yeah.
Because they're amazing.
Well, that's why when I was in New York and I had to take CEs, I would always find somebody who came from somewhere in Europe or some other country, because they would show me things that we have no idea.
When I went over to the UK, they treat reflexology like we treat massage. They don't understand that we group reflexology into massage here. They treat reflexology with the variety that we treat bodywork here. So they don't just have reflexologists. They have children's specialty reflexologists. They have reproductive specialty reflexologists. They have lymphatic specialty reflexologists. They have color specialty reflexologists. They have, let's see, neuro, Carol Samuel's work with nervous system reflexology. It's just amazing. Special needs.
Yeah, and they're allowed to diagnose, and it's
no, they're not.
In certain countries, they are.
In certain countries, but not in the UK specifically.
Are they considered a viable medical treatment there?
Not necessarily.
Not necessarily. Okay.
Yeah.
I know a lot of people are using them to kind of take the pressure off of the NHS over there.
Yeah.
So like they get a lot more practical application than we do over here.
Yeah.
Speaking of reproductive reflexology, Barbara Scott just logged on.
Barbara! Hi, Barbara! Just as a secondary plug, she'll be coming here. She'll be doing a 4-day class at the Institute in July. So fun. Oh, so excited. And I think, you know, one of the things that we're going to talk about this weekend, but especially when we get into like the digestive weekend as well, you know, one of our job as healthcare providers is to talk plainly about the stuff that our clients think is really gross or off the beaten path. So like we need to have very frank conversations about poop and pee and menses and mental health, and we do bridge that gap in the fact that we are medical professionals with a limited scope of practice, but that gives us the ability to talk with our clients about what their options are, who they need to be going to see, because we're their bridge between, you know, Dr. Google and the actual doctors. And so we get that chance to say, hey, look, I'm seeing something wrong in the tissues. You might want to see a specialist about that. But then likewise, I have so many clients that come to me because they're trying to get off medications from the specialists. So it really, we get to play that psychopompic role in terms of, you know, bringing people both to a state of greater healthcare, but then away from a state of greater healthcare as needed. You know, never taking somebody off their medications as a goal, you know, because we need to respect the system that we have in place and play by our own rules and laws. But, you know, just like Scott said, the idea that the modern medical system cannot possibly keep up with the demand of, you know, 15-minute sessions for complex issues. How would you feel if you had to do 15-minute sessions on somebody and fix all their problems in 15 minutes? Yeah, it's just a lot of pressure to put on any practitioner, let alone somebody who needs to know so much. Poor doctors. Okay. And after all of that releasing, after all of that movement, we make a nice. We say, I'm sorry. We say, thank you. We say, I appreciate you. And all of that comes in the form of some lovely hot towels. Also, just from a practical note, like you kind of greased up somebody's feet, so don't let them like slip and slide all over the floor. Just as an FYI.
And for some of the people who are watching, there were a couple of questions that got missed, a couple of, you know, little technical things or questions about specific media that you use, that kind of thing. So we'll get back to them.
Yeah.
You know,
I'll respond to them.
Watch this space.
After our hot towels are done, then we're going to finish with the first 2 points that we did, the solar plexus and the adrenal. And that's really what helps the nervous system to recognize that we're stopping the session. You know, the hot towels are a great way to bring somebody back from that very deep, relaxing place. There's temperature change, there's texture change. You know, it's a great way to just pull somebody back into the room. You know, but in terms of the nervous system itself, especially as clients become more consistent or as they've experienced this brand of reflexology before, the body will start to realize, okay, we're pressing the on button and then we're pressing the off button, you know, and that'll give us some cross-reference. How has her pulse changed? Her pulse has become less agitated. There's still a significant amount of fluid in the tissues, but the pulse is beating more rhythmically, also softer, but still very present. All signs of balancing. Solar plexus is not as cold. And then we swing into the adrenals. And we're good. And just to bring them back a little bit more, I'll normally cup the heels, do a little bit of traction, and then bring my hands to the top of the feet, and that'll be that. Cool. So, as a session ends, I'll collect my towels, I'll lift my chair up, and I'll say, start taking a few nice deep breaths for me. There is absolutely no rush to bring yourself back. Please take your time, and I'll meet you back out front in a few. And then quickly exit.